Hey, so good morning everyone. Today is the last surgery of the year video since our lovely patient has agreed to help other patients be better informed about this procedure.
My name is Abhinab. So I'm doing a hair transplant of 2000 FUE.
We've prepped the scalp this morning with a ring block, which means we use a very small amount of local anesthetics such as lidocaine. This allows us to go around the ring of the bottom of the scalp and achieve maximum anesthesia with the minimal concentration of local anesthetic.
Well, increased confidence because I'm going to go to international conferences, which will help me present better and look more confident in presenting.
The speed at which we cut the skin, the rotational velocity of the blade, and also the torque all impact graft quality. And so I prefer to use the lowest torque possible because speed is not the name of the game. Well, it's a balance, but speed is not always the name of the game because you want to remove the follicles in a time-efficient manner because out-of-body time matters. Once these grafts are out of the body, the clock's ticking and we have to get them back in. But at the same time, you don't want to rush this procedure at the expense of damaging the follicles.
It's been very informative. I got a lot of information of how the hair transplant is done, the pros and cons of doing it, and the right kind of procedure that needs to be done.